Healthy Living on India Life Television. Brought to you by Brookhaven Heart. You are at the heart of everything we do.
Welcome back to Healthy Living on India Life Television. We have important information to share with you, and for that we have many doctors in our show. So let's continue the show. There is a question I would like to bring it up because being a cardiologist, recently you mentioned, Dr. Joseph, you mentioned that coconut oil is not healthy. But Dr. Oz has been promoting to the general public that coconut oil is healthy. A tablespoon 3 times a day is going to be healthy, and we started seeing it on all the supermarkets and on the shelves that the coconut oil is being sold out, and people have a misperception that the coconut oil is healthy and it is good for the diet. So what do you have to say? You mentioned it is not good. So how do we, as a layperson, when they come to the cardiologist office, how do you rectify this and clarify the info with the patients?
Sure. So coconut oil, anything in moderation, right? So coconut oil, when it's refined coconut oil, is high in saturated fat. It's not that I cannot use coconut oil whatsoever, but if you use it consistently as a regular oil for cooking purpose and every day, that adds a lot of saturated fat. Of course, we can have a certain amount of saturated fat in our diet. Of course, we can have a certain amount of cholesterol. The more the saturated fat we eat, the more the chance of plaque buildup. So grated coconut, for example, is less. There is more fiber in it, there is less saturated fat in it. But refined coconut oil, if you consume on a daily basis, that's not good for your body. To promote atherogenesis, which is plaque buildup, which increases the risk of heart attack. But certain other vegetable oils like canola and sunflower have much less saturated fat. And that's why coconut oil consuming, it's not that you cannot use it, but
in a moderate. Okay, thank you. My next question is to Dr. Alexander. The forms of exercise, what do you recommend for a cardiac patient?
In terms of exercise, I would digress a little bit, not in terms of just exercise for cardiac patients, but for people in general. I think 30 minutes of aerobic exercise 5 days a week is probably that's recommended. A brisk walking, it could be an elliptical, treadmill, any of those things that you'd like can be used, but I think consistency is actually more important here.
Thank you, Doctor.
And if I may add that another misnomer amongst our community is that in patients who do have cardiac diseases, who've had heart attacks, who've had bypass surgery, stents, that there is this notion of just being at home and resting and not doing or pushing yourself too much. And again, this is a misnomer, and that all cardiac patients specifically should be focusing more on exercising, and that after a heart attack, whereas previously we used to feel that there should be a long recovery time, we actually encourage patients to start exercising very soon after a heart attack, because this will help to prevent another heart attack from happening.
Thank you.
And if I may add on something, I sometimes get patients who are obese, they have joint problems, and they want to exercise but they cannot. And one alternative is to try water aerobics and swimming sometimes, because I understand it's not for everyone. Some people may not have access to pools, but it's something that can be easy on joints because of being in water. They can exercise better and at least stay fit.
Dr. Joseph, how often and at what age does a person start seeing a cardiologist?
That's a great question. So in general, good healthcare checkups start from pregnancy itself, and as a newborn, if you're a good pediatrician, specific cardiac condition, people can be born with heart conditions, so those things will be detected through good pediatric checkups, good neonatal care, etc. But in general, depending on the population, South Asian population, we hear terrible news about people dying at the age of late 30s, early 40s without having suddenly dying, collapsing and dying. So South Asian population get heart disease, cardiovascular disease. When I say cardiovascular disease, the most common disease which we worry about is plaque buildup in the arteries, and this plaque buildup can cause heart attacks and strokes depending on where the plaque is built up. Sometimes plaque cracks, and of course that's how a heart attack happens, and without any warning symptoms. Some patients are fortunate to get warning symptoms to get the care they need before something catastrophic happens. But in general, since in South Asian population, because of genetic predisposition, heart disease starts approximately 10 years earlier. So I would recommend in males in the age of early 40s in South Asian population to see a cardiologist. Depending on, again, as I mentioned, a good healthcare starts from good pediatric care, good primary care, and primary care physicians may detect situations where they have to see a cardiologist earlier, maybe 30s, maybe 20s. But if I had to make a general statement in South Asian population in 40s for males and females early 50s, that's what I recommend.
So one other aspect to touch upon in terms of follow-up care and establishing care, we know that typical symptoms of cardiovascular disease such as chest pain, shortness of breath are what may bring people to come see a cardiologist. But it's important to highlight that in patients who are diabetic and in women particularly, their symptom presentation may be very subtle. So women and diabetics oftentimes don't have the typical manifestation of cardiovascular disease. So it's very important that if there's any sort of risk factor profile or strong family history, and if those particular patients do have any sort of symptom, they should seek further evaluation, whether it's through their primary care doctor or coming to see us so we could assess and treat appropriately.
Our viewers around the world, we need to take a short break. There is so much to talk about in our show, Healthy Living. And we have many more doctors who will be sharing the important and vital medical information about heart health, which is important to all. We'll be right back.
Healthy Living on India Life Television. Brought to you by Brookhaven Heart. You are at the heart of everything we do. Board-certified cardiologists in East Patchogue, New Hyde Park, and Hicksville, New York. Call 631-654-3278 for an appointment. Same-day appointments, evening hours, short wait times, affordable self-pay fees, quality care, state-of-the-art treatments, exceptional staff, informed patients, vein clinic, cardiac pedet services, amazing and caring medical doctors to treat you well. Visit our offices located near you. Brookhaven Heart, you are at the heart of everything we do.